Hello everyone. I am myself Dr. Rajesh Gubba. I am the general medicine educator. So this session I'll be doing the discussion of the quiz which I have posted on my Telegram channel, that is on 8th of May. My Telegram channel is Medicine Made Easy by Dr. Rajesh Gubba. So every day I'm posting the quiz and on subsequent day I'm sending you the explanation as well. So join my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba, for daily quiz discussion. So as a part of it, if you see the first question, all of the following true are about Lurching Gate except. So the question is basically about what is a false statement regarding the Lurching Gate. The options are: patient lurch on the normal side, that is non-paralyzed side. It is due to unilateral weakness of gluteus medius muscle. Fall of pelvis on non-parallel side. It is seen in polio. So if you take the Lurching Gate, definitely it is the one which is seen in polio. And the Lurching Gate, it is mainly because of the weakness of the gluteus medius muscle. And whenever the patient lurch, the patient will not lurch on the normal side. The patient, he will lurch on the paralyzed side, right? And the fall of the pelvis will be there on the non-paralyzed side. So your B, C, D are correct, but A is incorrect. And where do you see this Lurching Gate? It is classically seen in patients with the polio. So the answer here is the first option. Patient lurch on the normal side is an incorrect statement. The question asked is except. So he will lurch onto the paralyzed side, not onto the normal side. The next question: which of the following is false regarding the essential tremors? It is commonest movement disorder, manifest as postural or action tremors. Treatment is propranolol. Frequency is 4 to 6 Hz. Now, if you take the essential tremors, right, this is one of the most common movement disorder. Actually, we have many movement disorders. I'll show you all those. But one of the most common movement disorder is the essential tremors. And this particular essential tremor, it manifests as the postural or the action tremor. And it is being treated by the beta blocker, that is propranolol is considered as the drug of choice. But if you take the frequency of this essential tremors, it is not 4 to 6 Hz. The frequency of this essential tremors is around 6 to 10 Hz. So the answer is, right, 4 to 6 Hz is the false statement. Now you take the various movement disorders. So various movement disorders, like what we have is tremors, right, which is nothing but rhythmic, involuntary, shaking or quivering movements. That is your tremor. Next is the dystonia. Dystonia, it is due to muscle contraction, and this muscle contraction, it occurs repeatedly, sustained or repetitive muscle contraction that causes twisting or abnormal movements or abnormal posturing. Then another important abnormal movement is chorea, where there is involuntary, rapid, irregular movements that affects the limbs, face, and as well as the other parts of the body. That is what is your chorea. And another important abnormal movement is athetosis, which is nothing but slow rhythm, involuntary movements that affects the hands, feet, and as well as the face. Next is myoclonus. Myoclonus, it is sudden, brief, involuntary muscle contraction that can affect the single muscle fiber. Okay. If it is due to contraction of the single muscle fiber, that will result in what is called myoclonus. Whereas tics, if you see, these are the sudden repetitive movements. So these are the various movement disorders, out of which the essential tremors, these are the most common movement disorders. And if you see the third question, all of the following are true about the Huntington's disease except. Huntington's disease, like options are chorea, increased CAG repeat, early onset of memory loss, and then seizures. So if you see chorea, yes, the name itself is called Huntington's chorea, and this Huntington's chorea, it is a genetic disorder, and it is due to mutation of the gene, that is Huntington gene. And this Huntington gene, where is it present? It is present on the chromosome 4, right? And in these individuals, what exactly is the problem within the gene? That is increase in the CAG repeat. And these patients, along with this abnormal movement chorea, there will be also presence of seizures. And what about memory loss? Memory loss will also be there in patients with the Huntington's disease, but it is not early onset memory loss. The memory loss, it will be in the late stages. That's a very, very important point related to the Huntington's chorea, right? Now, after having discussed about the question related to Huntington's chorea, next is Which of the following is false regarding the hyperkinetic movement disorders? The options are: chorea is due to lesion in the caudate nucleus, hemibalismus is due to lesion in the subthalamic nucleus, dystonia is due to lesion in the putamen, athetosis is due to lesion in the globus pallidus. So, like, which is the incorrect statement? Chorea, yes, it occurs due to lesion in the caudate nucleus. Hemibalismus, yes, it occurs due to lesion in the subthalamic nucleus. But dystonia, it is not due to the lesion in the putamen. So dystonia, basically, this is a genetic mutation, right? And what is the most common genetic mutation that can make the individual to go into a state of dystonia? That is DYT1 gene. Right, this is the one which is most commonly mutated, and this DYT1 gene, it is present on the chromosome 9. Okay, so the answer, right, the false statement. So the option is C. Dystonia is due to lesion in the putamen, and athetosis, it is due to lesion in the globus pallidus. That is the correct statement. So these are the various hyperkinetic disorders, and you also need to be aware of where exactly is the site of lesion. And the last question is about the restless leg syndrome. All of the following are core symptoms for diagnosis of restless leg syndrome except unpleasant sensation on the legs, symptoms begin with the rest, symptoms improved by alcohol, symptoms become worse in evening or night. So if you take this restless leg syndrome, these symptoms, they are very unpleasant symptoms within the legs, and symptoms, yes, they begin with the rest. And when do the symptoms improve? It is not with alcohol. Symptoms will improve with the movement. It is not by the alcohol. And symptoms become worse in the evening or night. That is also a true statement. So which is the incorrect statement? Except here, the symptoms improved by alcohol is a incorrect statement, and symptoms are improved by the movement. So these are the 5 questions of the today's quiz that on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. So you can join that for daily quiz discussion. So thank you very much. See you tomorrow again.